Welcome to AUA Leadership in Business, an official podcast of the American Urological Association.
Welcome to the AUA Leadership in Business podcast, where urologic professionals experience the practical application of business acumen essential for success in today's dynamic professional landscape. I'm Dr. Jennifer Miles Thomas, and in today's episode, we will discuss the VA model for urologic care. Joining me today for this discussion is Dr. Jeffrey Jones. Welcome, Dr. Jones.
Hello, how is everybody?
Well, very, very well. In kind of prepping for this episode, I learned a little bit more about you. You have a very varied experience in urology, in aerospace, medicine. Can you kind of talk from the very beginning about just your journey into urology, what else you've done? Because it's very different. It's not the standard went to med school, did your residency, and now working at the VA. So can you kind of describe what you did?
Well, sure. Although I hope it's not too much for your listening audience, but I'm glad to share my pathway. I went to college at Trinity University in San Antonio, and then went to Indiana University for my residency, trained with John Donahue and Randy Rowland. I stayed there for an extra year to do a urologic oncology fellowship, and had a chance to work at the Eli Lilly labs in tumor biology during that time under the AFUD. Back in the day, they had the AFUD fellowships. And then after I completed that, I went on to Texas Tech University Health Sciences Center and was the chief of urology there and the associate cancer center director for surgical services at Texas Tech. But then I got a call from an old DeBakey associate faculty member, Dave Short, who was good friends with the NASA center director, Mr. Abbey at the time. And he said, hey, we're having some issues with kidney stones in astronauts. Do you mind coming working with us for a while and see if you could help us out, which I did. And then while I was there, they said, we really would like you to stay on as one of our flight surgeons. And in order to do that, you need to be board certified in aerospace medicine. So I did a fellowship in aerospace medicine at that point, and then worked for NASA for 13 years as a flight surgeon for the space shuttle program, and then the International Space Station program. And then and I headed up the ISS medical operations for a while, and then I moved on into the Constellation program as the head of the medical operations for exploration, and then the program got shut down about the time I got called on to active duty for the military, and I went to Iraq for a couple of years. I served both in Operation Iraqi Freedom and Operation Enduring Freedom. I was what they call the officer in charge of the Flightline Aid Station at Al Assad in Al Anbar province in Iraq during the war, and flew 75 combat missions with a Prowler Squadron, as well as some missions with the C-130 Hercules and some of the rotary wing missions that we had. When I got back, I worked the very last space shuttle mission at NASA, and then I left NASA to go back into urology, which I did for a couple of years in private practice in Durango, Colorado, while Dr. Coburn was trying to get the position at the VA ready for me to take over as chief there. And I did that a little more than 10 years ago, and I've been here, the chief of urology at the Michael E. DeBakey VA Medical Center in Houston, and have kind of gone up the ranks, and now I'm the associate executive, or what do you call it, deputy executive for the operative care line for inpatient services here at this facility. Hopefully that wasn't too much too fast.
No, it just shows that a lot of times we think in urology it's just a straight path, but you had so many different experiences and actually gave so much for your country, for our scientific exploration of space. It's just, we are so multifaceted. Sometimes we forget that there's many other things that we can do in life. And then you came back to urology too. So if we kind of pivot to the VA practice model, because that's what you came back to, can you, for the people who either didn't train at a VA or don't have one that they currently practice in, can you kind of give us an overview of the VA medical practice model, its role, what are the benefits, and then are there really opportunities for growth and leadership? Sometimes if it's in a box and we don't know from the outside, we're not sure what's available.
Sure. Well, first is understand that the VA is an integrated healthcare system with the Department of Defense now. They used to be a little bit more stovepiped, but now things are integrated. And so you might have heard the term for like toxic substances, cradle to grave responsibility, where I think here we refer to it more as enlistment to grave. So the medical care system is responsible for the military service member from when they start service until they leave us on this planet. And the VA picks up after they get off of active duty. There are a lot of active duty facilities, 55 hospitals and 373 clinics worldwide to care for the 1.4 million active duty and 330,000 reserve members of the military. But when we talk about the VA, we're talking about a much larger population. 9 million veterans are cared for in the VA system, and it's the nation's largest integrated healthcare system. It includes 152 hospitals, 1,400 outpatient clinics, 126 nursing homes, and 35 domiciliaries. And the care varies anywhere from, we talked about a rural community outpatient clinic, all the way up to what we call a Tier 1A hospital, which is tertiary care, typically integrated with an academic affiliate. And many of our Tier 1A facilities, the faculty at the VA are also academic members, professors or assistant associate professors at a nearby academic institution. And here in Houston, it's Baylor College of Medicine, but it can be any private or state-funded academic affiliate. And so that gives the veterans opportunity to receive state-of-the-art care. And I think that's one of the important things to understand about the VA is that the VA has access to some of the best equipment and surgical care that's available anywhere in the country. If you look at quality of outcomes, VA Tier 1A facilities have quality scores that are between 15 and 20% higher than that of Medicare programs at private hospitals. And we have lower adjusted risk mortality scores than at those same hospitals. So the quality of the care that's being given at the Tier 1A facilities is second to none. I think that's important for people to understand. And the other thing you asked about was opportunities for physicians. I think that the VA is a little different from the private practice scenario in that VA physicians are not as focused on things like pre-authorization and practice management, billing and collections, things that private practitioners spend a lot of time worrying about. There are people in the VA that do those things for veterans that have CMS, like Medicare or Medicaid, or have private indemnity insurance. But the practitioner within the VA can focus their energies, their time on patient care. And I think that's a great thing about being a VA doc, is that we don't get wrapped up in many of these other things. We still have our work RVUs track. Don't get me wrong. Productivity is important, but it's productivity in patient care specifically that's being monitored. Um, I'd say the other thing that's important is that there are federal resources to make sure we can get the latest, greatest state-of-the-art care for our veterans. And we kind of tease the local hospitals in the sense that there's a motto of one of the private hospitals that they're leading medicine. Well, typically we at the VA here in Houston get the latest technology prior to those private hospitals getting it. So we're staying on top of the technology envelope here and pushing that envelope forward for our veterans to make sure they have the best possible care possible.
Yeah, I think in a fully integrated system, your quality metrics are very high, because I think a lot of veterans do get all of their care at the VA. So you can kind of do it a lot more. You can monitor more longitudinally, and sometimes outside of that system, it's kind of haphazard care. So I really appreciate that. Well,
Before you leave that, it's worth commenting that the electronic medical record that we have in the VA was one of the first EMRs, and it is the longest running, most comprehensive, and the most number of current patients in the system than anywhere in the country, and one of the largest in the world. The DoD and the VA have agreed to a common EMR, and that integration is still ongoing with Cerner. But the current Vista CPRS allows us to track through common databases all around the country, and there are individuals in these database management systems that can provide practitioners with national statistics as well as national research opportunities about disease states. And now we have the nationwide Million Veteran Program for next generation sequencing. We had the Vinci database that allows you to look at specific disease states like prostate cancer, bladder cancer across the entire national spectrum. So I think that that's another important power within the VA system that's not readily apparent within the private arena or even in individual academic medical centers.
Yeah, that's much appreciated for someone who's not working in the VA system. I did notice that recently patients are able actually to present and pull up their labs. I know historically we always had the idea that sometimes it was hard to get any data if you're outside of a VA, from the VA, but definitely you guys are much more technologically advanced than we thought, and so well integrated. EMR, the fact that all of that data is stored, you can study it, you can understand different trends, and then actively intercept potential and change outcomes for patients. So that is much appreciated. So thank you.
Yeah, as an example, here at our VA, we have 2 XI robots, 1 SP robot. We have blue light for bladder cancer detection. Mm-hmm. We have HIFU. We have the EndoEye 3D lap systems for donor nephrectomies. You name the technology, we have it here. And we were one of the first in the area and often in the state of Texas to get that technology for our veterans.
Well, thank you very much for that, to kind of informing everyone who's not in the system truly what's available. Now, you've also had a very vast experience when we kind of went through your career journey. What experience did you have, or what were the moments that made you look to the VA to continue your career?
Well, I think it's several fold. Obviously, as I mentioned, after I finished my tour at NASA and I was off active duty from the military, Dr. Coburn and the Baylor College of Medicine recruited me to come back to the university, but they needed a chief at the VA, and that was their vision, to have someone who was a veteran, who had veterans primary interest in mind to serve as the chief at our VA. But the thing that I think was most important for me is I wanted an opportunity to continue to serve veterans. I served military service members as active duty and reserve physician, and the chance to continue that service in the VA for retired military service members that were veterans, to me, was very appealing. Uh, I think it's not only helpful for me in terms of my own personal satisfaction, but I think it helps the veterans too, to have a fellow veteran taking care of them. They can relate to me sometimes easier than the non-veterans. We speak the same language, so to speak, and we have common experiences that we can share. And I can tell them I get it, and they have confidence that that's true.
I agree. Sometimes patients need to relate to their physicians in a different way than just the physician-patient relationship. And I really appreciate that, where there's the immediate trust and understanding too. For those of us who are outside of the military complex, why do you think working at the VA would be fulfilling if we don't have that immediate connection given our history?
Yeah, for those that are non-veterans, there are a lot of benefits to working in the VA. I already mentioned if you're not that enthralled with practice management skills and practice management oversight, it allows you to focus on patient care. And I think that there are a lot of individuals that don't have that business acumen, or that don't like to worry about those things. And so focusing your energy on patient care is very attractive. The VA provides a very stable professional environment and income. It's not something where you're constantly having to negotiate and renegotiate your contract with the hospital. You're not worried that somebody is going to withhold part of your pay, or that you have to meet a certain RVU target in order to get your pay. The VA does offer regular promotions through the GS system, and there's adjustments in salary through what's called locality pay and comparability pay. That tries to keep it fairly comparable to what physicians are receiving in the community. And then there's performance bonus opportunities up to about $15,000 a year, based on you meeting specific performance metrics that the VA has for their practitioners. So there's the focus on patient care. There's the stable remuneration elements. The retirement and benefits packages are quite good. Kind of, I would say, blue star options for healthcare for you and your family, dental care, eye care. But then the retirement program is quite robust. There's the FERS, the Federal Employee Retirement System. There's the TSP, which is an optional retirement program where you can participate with, for example, it's very similar to a 403B. So you had the FERS, which is like an annuity. Then you have an optional retirement program, TSP, that's like a 403B, where you can pick various options for your investment opportunity. And then there's the opportunity to invest in a Roth IRA, which you cannot do as a non-federal employee because typically physicians make too money to utilize that Roth option, but as a federal employee, you can. And so that allows you to invest in and then withdraw a tax-free investment. So I think that all of that makes it very meaningful to practice within the VA. And I think that the third important element is the great camaraderie with all the other physicians and other practitioners within your VA hospital, not just locally at your own VA, but with VAs across the country. We have groups that work together. One's called the USAV, the Urologic Society of American Veterans, that coalesces efforts for urologic care within the entire VA system. And then we also collaborate with our DoD equivalents in urology through the Society of Government Service Urology. We have joint meetings. The Kimbrough Urologic is a joint DoD VA meeting that's held every year. So there's, I think, a very good collegial collaborative relationship with practitioners within the VA network.
I agree. I think with our current workforce and the shortages that we have currently and what's anticipated, I think a lot of urologists are just looking at the different models, different practice models. And I think previously we've always had the discussion regarding private practice, PE-based practices, academic, hospital employment. But this is really interesting to hear about the VA-based model, because I don't think it's something that we typically talk about, and we don't hear about it as much, especially if we didn't train in a center that had a VA. So any other final thoughts about why a urologist should choose the VA practice model as a very rich and rewarding career? You've mentioned some, but anything else you really want our listeners to take away with?
Well, there's a couple other things. First is the VAs have initiated what we call patient-aligned healthcare teams, and and it's called PACT, which is different from the PACT Act, which is an act, actually the largest healthcare benefit act the VA has ever introduced to make sure that veterans with toxic exposures have access to healthcare. But we're talking about PACT as in patient-aligned healthcare teams. So each team is composed of a primary care doc, nursing personnel, pharmacist, social worker that are on that veteran's team, and they coordinate the care of that veteran, bringing in the specialist as needed, depending on the veteran's condition. So I think that's a very strong kind of medical home model to make sure that we don't have veterans slipping through the cracks. So I think that's a strong selling point on why an individual would want to practice within a VA system, knowing that that type of teamwork is present for patient care. You can work anywhere from a CBOC, a community-based outpatient clinic in a rural setting, all the way up into a major metropolitan urban academic affiliated center. So whichever style of medicine you want to practice, it's available within the VA system. And you can move from one to the other over your career if you'd like. There's also opportunities for leadership. If you want to be a section chief, if you want to be a care line executive, if you'd like to move up above your specialty area and be the chief of staff or a deputy chief of staff at your hospital, it's possible. A lot of physicians do that and become physician executives, and there's training within the VA to become a physician executive. There's also ability, if you want to get into healthcare policy, you can go up and work for the VA Secretary's office and serve in Washington, D.C. So there's a lot of opportunity for advancement in the kind of a physician executive arena if you prefer that, or you can stay practicing basic medicine your entire career. It's up to you as to what you want to pursue, and there are constantly opportunities to take on other career goals and objectives if you'd like to, and you can serve purely in a non-academic setting, or you can be a part of a major medical school faculty and have fully integrated responsibilities with medical student, resident, and fellow training, if that's your cup of tea. So there's lots of variability in career opportunities within the VA. And I would say, as a kind of a final statement, one, the VA is a dynamic, challenging, rewarding place to practice medicine. Number two, the medical care you will provide is state of the art. Number three, you as a physician can have a very high quality of life. You don't have the stress worrying about billing, pre-authorization, and those types of things. And you can focus on your medical practice and be comforted knowing that both your reimbursement, your benefits, and your retirement are secure. And then lastly, there's this personal satisfaction I spoke of earlier, knowing that you are caring for the nation's heroes. You're caring for U.S. military veterans who have personally sacrificed so much for our nation to protect Americans and even the world. And you are an individual who has a chance to give back to them. So I think that's a high degree of personal satisfaction that comes from that.
Well, thank you very much. There's a lot about the VA I did not know at all. And I personally, coming from a military family, I really appreciate your dedication to our veterans. And just want to say thank you, Dr. Jones, for sharing your time and expertise with us today.
You're welcome. Thank you very much for having me on your show and a chance to share my experience with all your listeners.
Well, thank you. And thank you to our audience for joining us on the AUA Leadership in Business podcast. Until next time, continue to learn, lead, and excel. Thank you.
Thank you for listening. If you enjoyed this episode, make AUA Leadership in Business your go-to podcast. Subscribe today by searching AUA Leadership in Business on your favorite podcast app and enhance your leadership and business education needs.